My name is Eric Spencer, and I want to tell you about Cholera in India for the fall 2014 semester of medicinal chemistry. I will begin this presentation with a general overview of cholera and the origin of the epidemics. Then I will briefly discuss India's geography as well as the quality of its water supply. Next, I will discuss the MOA of cholera, and finally, the treatment and vaccinations. First off, cholera is a gastrointestinal infection caused by the bacterium Vibrio cholerae, and the symptoms include vomiting and diarrhea, which can lead to dehydration. There have been 7 recorded pandemics of cholera, 6 of which began in India. India is located in South Asia, east of Pakistan, and south of China and Nepal. It has a population of over 1.2 billion and an area of over 3 million square kilometers, making it the second most populated and 7th largest country. India's climate is also heavily influenced by the Himalayas and the Thar Desert. By international standards, India suffers from poor water sanitation. And this is unfortunate because cholera typically spreads by consuming water or food contaminated with infected fecal matter, and approximately 665 million people living in India practice open defecation. It's also not uncommon for open drains to be contaminated by overflow of raw sewage. These factors help to explain the many outbreaks of cholera in the country. As mentioned before, cholera is generally contracted by ingesting food or water contaminated with infected waste material. This is further propagated by the poor water sanitation standards, as well as the practice of open defecation in certain parts of India. Children ages 2 to 4 have the highest rate of infection. Also, blood type seems to be a factor as type O is the most susceptible to infection. Symptoms can appear in as little as 5 days after ingesting the bacteria. Symptoms include diarrhea and vomiting a clear liquid. The diarrhea is sometimes referred to as rice water and may have a fish-like odor. Fever may occur, though it's rare and is cause to suspect another infection. Because of the high water loss, high blood pressure can be expected and acidosis can result in labored breathing. If left untreated, the symptoms of diarrhea can dehydrate and kill the victim. Most of the ingested bacteria are unable to survive the conditions of the stomach. So to compensate for this, it conserves energy by shutting down most of its protein production. Thick mucus lines the intestinal walls, which the bacteria must propel itself through. This is done by producing the protein flagellin, which makes flagella. And once the bacteria reaches the intestinal wall, it begins to produce the toxin CTX, which results in the diarrhea. The infected stool is released into water systems, where it's consumed by another organism, and the cycle repeats. Usually, the symptoms of diarrhea can be treated with oral rehydration therapy. Rice-based solutions are generally used. If dehydration is severe enough, intravenous rehydration may be used. Antibiotics can decrease the duration of disease and reduce the severity of the symptoms. However, they may not be needed if the person remains hydrated. Doxycycline, erythromycin, and tetracycline are some effective antibiotics. Oral vaccines Dukoral and Shanchol can also be administered, though proper hygiene and water quality standards are the best prevention.